our translator feed.
Okay. All right, then I'm going to get started. So welcome everyone. I'm Jody Monroe, Superintendent. Thanks for taking time out of your day to join us. What we're going to do this afternoon is to present questions and answers. Thank you for submitting your questions in advance. We did have a presentation Monday as well, and so we've updated this a little bit from some of the questions and the feedback we received from that as well. So as we're going through the presentation, if you do have additional questions, if you put them in the Q&A, we will try to get to those questions at the end of our presentation. And any questions we're not able to get to, we will do a follow-up Q&A for everybody. So Dave Hurst is here, our Assistant Superintendent, Joanne Menrath, our District Nurse Coordinator, Laura Heffernan, our Principal at Glenmont Elementary, and Dave Domel, our Principal at Bethlehem High School. And we are hoping to have Dr. Gafuri, our School Medical Director, joining us at some point this afternoon as well. If you'd like to access the closed captioning, these are the directions to do so. If you click the live transcript at the bottom of your screen and then click show subtitle, you should have that active on your screen. Also, for live translation of tonight's meeting in Turkish, Chinese, Spanish, or Portuguese, here is the link to access that. The link has also been emailed to you. This session is being recorded and will also be translated into the languages noted above. So as I mentioned, these questions were submitted in advance. We did consolidate. We had several of similar questions and will be answered as part of the presentation. If you did submit a question ahead of time, it's not directly covered in today's presentation. You can always email me directly, or if you have a specific question related to your situation, again, please email me directly. Questions can also, as I mentioned, be submitted in the Q&A as we're going through the presentation, and we will hopefully be able to respond to all of those at the end. Hopefully you've had a chance to take a look at our reopening plan that we sent out, I guess a little over a week ago. Our goal is to have all students return for in-person instruction. This has been supported by the CDC, the American Academy of Pediatrics, and the New York State Education Department, believing that students really need to be back in school in person. And the first day of school, which we're looking forward to for students, is Thursday, September 9th. Our primary goal is to ensure a healthy learning environment. And if you have had a chance to take a look at our reopening plan, you'll see we've relied on a layered mitigation plan, which we'll talk about during the presentation this evening. Albany County is currently in an area of what's considered high community transmission. As we move ahead, a combination of COVID mitigation protocols will be adjusted based on community transmission. We do anticipate, unlike last year where our plan really didn't change much until really the end of the year, we do anticipate our plan being a little more fluid this year and changing as we move forward. This plan was developed by the district and building leaders in combination of the reopening task force, which is made up of parents, Board of Education members, our district medical director, and again, district and building leaders and teachers. On August 24th, our new governor did announce her support for mandatory vaccination for all New York State teachers and school staff, with an option for those who are unvaccinated to have weekly COVID testing. We are expecting to get more information later this week. I heard possibly Friday. As soon as we have that information, we will share that out or update our plan accordingly. Masks in school will also be a state requirement with, again, a directive from the New York State Department of Health, which we're anticipating we'll receive, again, hopefully this week. When I reference community transmission, this is accessible online for anyone who would like to take a look at it. It is linked in our reopening plan. This is how the community transmission is calculated through the CDC. And as I indicated, we are currently in the red zone, the high community transmission. I also mentioned our layered mitigation plan. So some of the things we'll talk about this afternoon. Obviously, self-screening. If you don't feel well, stay home and contact your physician. We'll continue to encourage hand hygiene, respiratory etiquette. Face masks are required for the start of the school year. The physical distancing is a little bit different than last year, where it was 6 feet. The minimum distance this year is 3 feet, as recommended by the CDC, 3 feet or greater. We will continue with our improved airflow and ventilation, daily cleaning and sanitizing. We will have a testing program in place, and we'll work with the Albany County Department of Health on contact tracing and any quarantining that needs to take place, and also encouraging vaccines for any students or staff who are eligible for the vaccines. This is the guidance we received the other day from Albany County Department of Health. My understanding as of today is this is still in draft form. So this may change. There also was an indication that we might be getting something from the State Department of Health as well. But this is on our website. This talks about what the local health department will do to determine if a student or staff member does need to quarantine. And essentially, when you look at these, they are following generally the CDC guidance of 3 feet distance or greater. There is a determination if a student or staff member is fully vaccinated or not, and symptoms also are a factor in determining quarantine or not. Again, if this changes or if we get updates to this, we'll be certain to let everyone know what those changes are. This is what we received on school transportation, and we were provided with some different examples of if there's a positive case, looking at generally a bus layout, who could expect to be quarantined as a result of that positive case. So again, this is all on our website. It is still, according to Albany County, draft. So if this changes or we get additional guidance, we will provide that to all of our families. And the lunchroom as well. Again, you can see the difference between if a student is fully vaccinated or not. Is the student symptomatic? And looking at more distance in the lunchroom than 3 feet. So as I mentioned, this was received the other day late. It was right before our prior parent meeting. We have been reviewing this information, and again, we'll continue to review it. We will work with Albany County on this. As I mentioned, it does largely follow the CDC guidelines and differentiates between vaccinated and unvaccinated individuals. Also, a big part of this guidance is properly worn face masks, physical distancing, and testing for close contacts. We have not received any guidance on high-risk activities or sports and co-curriculars. My understanding is we'll be receiving something separate in those areas hopefully soon. So on to the questions that were submitted. Again, for those who are just joining us, if you have questions during the course of the presentation, please feel free to put them in the Q&A. We'll try to respond to them at the end of the presentation. The mask rules I've already indicated. Indoors, we are requiring masks at all times. We do expect this to be a New York State mandate that we'll receive soon. Outdoors, when 3 feet of distance cannot be maintained. So I have had a few questions related to this. So for example, if students are outside with a teacher doing silent reading, or they're seated 3 feet apart outdoors, they can remove their mask as long as the teacher can make sure students remain at 3 feet. For areas such as recess, where students are playing, it's less structured, and they're going to be less than 3 feet, or in physical education, where they might be doing an activity that puts students at less than 3 feet, then they would need to wear a mask when outdoors. The distancing rules in the classroom are, we are following the CDC guidelines, which is minimally 3 feet or larger to the greatest extent possible. So in some of our classrooms, depending upon the number of students in the space, we are able to have students greater than 3 feet apart, many of them between 4 and 5 feet. And we will make sure whenever we can distance greater than three feet, we will. The distancing rules are different for adults and students. In the CDC guidance, for a distance between students is 3 feet. Distance between adults and students is 6 feet. And then adults interaction, if they're both vaccinated, can be 3 feet. And if they're one or both are unvaccinated, the recommendation is 6 feet of distance. Why does there appear to be very few differences in district protocols from high to low rates of community spread? So the changing dynamics of the pandemic, especially what we're seeing now with the Delta variant, does require us to take a cautious approach as we reopen for the 2021-22 school year. We have everyone back this year, and we want to make sure that our schools stay open. So we are optimistic, however, that as transmission levels reduce, that we will be able to loosen some of our guidelines and restrictions. As I said earlier, we do expect our plan to be more fluid this year than it was last year. So we are hopeful that as things improve, we will be able to allow for more flexibility and have less restrictions in our buildings. The next question that came in was, does the governor's support of vaccines for all school teachers and staff mean there will be a vaccine mandate for BC employees? So we are waiting for more details. We have been collecting vaccination status from our employees actually since last school year. So we have a complete picture of what our vaccination status looks like between students and staff. We will publicly review the district's return to school plan and any updates that we receive from the state or the governor as part of the next Board of Education meeting, which is next Wednesday, September 1st. We're hoping that by then we will have any additional state guidance, any updates from the local, from Albany County, and any changes that we get between now and then will be shared at that meeting. Why are we requiring vaccination for football and volleyball? And will those teams we compete against will we still compete against teams that are not requiring this? The CDC guidance and state ed did indicate in their guidance that high risk activities, including football and volleyball, when you have high community transmission, should either be canceled or those individuals should be fully vaccinated. And that is the guidance we're following. This is part of our layered plan. It's designed to protect students and staff and hopefully ensure that our instructional program isn't compromised by either widespread quarantine or closure. We cannot control what other districts do. However, we can ensure what we are doing is the safest to protect our school community. So next, I'm going to turn the next set of questions over to Dave Hurst to respond.
Okay, thank you. So why is there no virtual option for students this year? As you saw this summer, the American Academy of Pediatrics did release its recommendations, as well as the CDC and New York State Department of Education. And they are all pushing for all K-12 students to be physically present in schools. That being said, if you are a family that has a child with a medical condition, which would deem them to be medically fragile, and you believe that they would be in the need of a virtual option, then we would ask that you contact your school nurse and provide them with the documentation explaining why you feel a virtual option would be needed for your student. Students would then have that medical documentation reviewed by our medical director, and we would seek clarification as necessary, and would need to be able to reach out to the family's physician to facilitate this. Another option is families could choose homeschooling for the year. And then finally, if a student is eligible for the virtual learning due to their medical necessity, this is something that they would have to commit to for the entire school year, as we would be doing this through a BCSD program, and they require a commitment for the full year. So this also, again, questions came in prior about vaccination status. If a child's vaccination status changes mid-year, that would not change the necessity for them to stay in the program for the full year. Will high school students be able to log into class from home if they're quarantined or sick? So no, we are not planning to offer synchronous simulcasting options or live streaming options, as many refer to it, due to the inherent difficulties and distraction in both teaching and learning when students are participating in dual modalities of learning. The degree to which students were engaged in 2020-21 was not, it was something we had to do because we could only have students here on an every other day basis, but it's certainly not best practice, and it is certainly not something we found to be a valuable experience to the greatest extent possible to having students here each day. You will note that if you look at schools that have been operating, virtual schools have been around for at least 20 years now, they do not operate under a hybrid model, right? Either students are fully online and also doing asynchronous work, or they might come to a brick and mortar setting for in-person instruction, but during that time, there's not students also connecting remotely. So we do feel that the best model is for all of our students to be here every day, and that we will not be synchronously simulcasting our lessons. We also, just to keep in mind, I think many are concerned about quarantines elevating to levels that were seen in the winter of last year. And when you take a look at the recent guidance from Albany County Department of Health, we do not believe that mass quarantining will occur. However, should situations change, again, this plan is fluid. And if we are put in a situation where we have an increase in absenteeism, we will certainly revisit this and look at other options down the road. So is there a contingency plan in place in the event cases spike again? So yes, as I just mentioned, if we were forced to go remote, we would implement. So this would be if the entire district or an entire building or whole classrooms were forced to go remote. We would implement similar schedules to what we had last year. And as you know, with our one-to-one program, students in grades 3 through 12 bring devices home every day. K2 have devices available every day within the school, so we could send those home for this emergency situation. So the next question is, what will my child's classroom look like? Unfortunately, they're going to look very much like they did last year. Student desks will be arranged at a minimum of 3 feet, as Jody mentioned prior. All desks will be facing the same direction as per CDC and DOH guidance. So students will not be able to face one another, be seated at tables, at least to start the school year. And again, this has been advised to us as being best practice. However, should transmission rates begin to drop, we will certainly look to build more flexibility into our classroom seating arrangements. So what happens if a child refuses to wear a mask in my child's classroom or on the bus? So if a student does not have a mask, we will absolutely provide them with one. We've also instructed all of our faculty and staff to speak directly to the student about the reasons why they need to follow the guidance. And again, this is really a learning experience for students. We're not looking to punish them if they're not wearing a mask. However, if they continue to refuse, now this becomes more of a defiance situation. So we would look to have the teacher or staff member contact an administrator. Parents and guardians would be contacted if necessary. Are there specific rules for mask breaks? So students may remove masks when eating or drinking during the designated food periods in assigned locations. And mask breaks could occur as directed by a teacher or school administrator. That being said, it is not best practice for an entire classroom, say, to take their masks off for a set number of time. It's really best when students stagger their mask breaks so that we don't have all of the students in a room taking their mask off at the same time. We saw last year that this worked quite well. Students routinely just pulled their mask down for a quick second, took a drink of water, put their mask back up, or if students needed prolonged breaks, they would excuse themselves to go into the hallway, or in the elementary classrooms with doors leading to the outside, they would actually be able to go outside and take a quick mask break. The protocols could change again based on transmission rates and changes in guidance. Obviously, when outside, students will have the option of unmasking for prolonged periods of time, so long as we can guarantee 3 feet of distance. So will there be choir and band this year? Yes, there will be choir and band. However, the distance requirements for these extracurriculars are a little bit more stringent. So if you're singing or playing wind instruments, the distance would be 6 feet instead of the 3 feet. So what happens when entire classrooms are quarantined if no remote learning? So again, if an entire classroom is quarantined, we would follow a schedule where, again, the teacher would meet online with the students for either their class period, or at the elementary level, they would have sort of a block schedule like we ran last year. And again, we're hoping that this, based on the guidance in terms of quarantine procedures, that this does not become a reality this year.
Next, I think the next few questions go to Laura Heffernan, so I'm going to turn it over to Laura to respond.
Thanks, Jody. In elementary school, will children rotate to the cafeteria in specials, or will those subjects happen in their classroom? So for most of last year, we did have, for example, art on a cart in the regular education classroom. But this year, we are pleased that the children will be able to go to their specials in the art room, the music room, the library. PE, we really try to do outside as much as possible. We will, however, continue with, at least for the start of the year, having lunch in the classrooms because we have a system down and we're able to make that work safely. There's too many students in a grade level, for example, to have them all go into the cafeteria and keep the children socially distanced, all facing in the same direction to be safe. Will fifth graders have nature's classroom this year? Right now, it's not looking likely, but last year we did have an on-site all day long science and nature event for fifth graders, which they really enjoyed. What are the classroom cleaning protocols this year? And this is for K-12. The daily disinfecting of the desks will be done by the teachers, either at the end of the day or in the morning. It's up to the teacher. Would it be possible for some students at the middle school to be allowed to take their lunch to their classroom desk to help minimize crowds, or for K-5 for students to eat outside? I confirmed with the middle school administration this afternoon to make sure I had this right. And there will be 2 locations for middle school lunch this year, in the library media center and also in the cafeteria, instead of the 3 that they had last year. And they will have student desks all facing the same direction and socially distanced. And it will be separated by team. They are not able to, unfortunately, have the students go to their classrooms because, first of all, there might be another class in the student's regular classroom when the student is at lunch. There's also some supervision issues. The teachers might not be available to supervise at that time because the teachers are often in team meetings or having their own lunch, or the teachers might be using that classroom for a team meeting. So that's not possible. In K-5, the students eat at their desks for lunch, and we have a new aide supervising them. So it can be challenging for the new aide to be in 2 places at once, both outside and inside. So for the most part, they will be eating inside at their desks. And it really worked quite well last year. So we're going to probably keep to that model. Will there be free and reduced lunch this year? Do I have to apply? Well, once again, breakfast and lunch is free for all students through the federal government for 21-22 school year, and you do not have to fill out an application. This is for all students. However, there are some additional government nutrition programs available to families who would otherwise qualify for free and reduced price lunch. So if you are a family who may qualify for this, you are encouraged to apply in order to be eligible for those additional benefits. But more information will be posted to the district website later this week, so you can check that out. Can teachers use fans in the classrooms? Yes, fans are allowed, and they were allowed back in the spring. We're not allowed to blow the fans directly on one student, but they should be blowing, for example, they can blow air out the window to kind of force the circulation that way, or blowing it up into the air, up towards the ceiling.
The next, it looks like the next few questions go to Dave Domel. So can we turn it over to Dave?
Good evening, everybody. First, just want to thank everybody for their support last year and their continued support into this year. Very optimistic, although we still have guidelines. They're much better than the presentation that we put together last year. So thank you again. Open house is similar to what it was last year. We are going to have a virtual setup. You will be given, at least at the high school, and I believe this is the same throughout the schools throughout the district, you will be sent a link. You can log in, your teachers will present to you and answer any questions that they can. But yeah, anyone that was part of it last year will be very similar. So what is the plan for students at the high school who do not have a lunch period? If you were in the high school last year and did not have a lunch, we set up areas where students could go to eat, but they were able to log in to their class because things were virtual. That not being, and not miss much instruction. That not being an option this year, we're having to adjust a little bit. Students are still going to have to talk to their teachers to make sure they get a time during a period that best suits them and the teacher, and we will be allowing them to simply just take a seat, go right outside the classroom, so they can kind of have an ear as to what's going on in the classroom and be listening while they get nourishment and continue on with their day. Some local high schools are allowing 11th and 12th graders to leave for lunch to help reduce crowding in the cafeteria. Has BCHS considered this or any other strategies? Yes, right from the beginning, we are going to be allowing seniors to have the privileges of going off campus, which means that they can go someplace to get lunch or go home to get lunch to reduce overcrowding. We are also going to have a mobile service station that will be in the central foyer for students if they want to, grab something quickly, a grab and go, so to speak, and eat either quickly in the cafeteria or in some of the desks that we're going to have in the central foyer area. So we have some things that are going to be set up to reduce crowding, and definitely one of them, a big one, will be the 12th graders being allowed to have their off-campus privileges. Will we be taking student attendance at the high school? Will return to normal? Absolutely. And this is going to be a large point of emphasis from the beginning of the year with the teachers, to the students, as well with the administration, with the students. We want students to be back in the building. We know that's when they're most successful. And we'll be placing a great emphasis on that in our class assemblies, and the teachers will be reinforcing that in the classroom as well. Will there be time the next 2 weeks for the high school students to walk their schedules? Yes, we've actually designated some times. An email, I believe, went out this afternoon, and those times are listed here. Monday, August 30th from 9 to 11, and then Tuesday, August 31st from 1 to 3. If you have an issue with one of those, just reach out to your counselor, and we'll try to accommodate as best we can.
The next group of questions go to Joanne Menras, so I'll turn it over to Joanne.
Thanks, Jody. Can you share what percentage of high school and middle school students are currently vaccinated? Well, as of Monday, the reports that we ran show that 80% of our high school students are fully vaccinated with another approximate 4% of students having received one dose of the 2-dose series. It's important to note at the middle school level that our grade 6 students are under the age of 12, and therefore they are not eligible for the COVID-19 vaccine. So that grade level does not have vaccinations available to them. But also in grade 7, 20% of those students are also not eligible due to their being less than 12 years of age. But even with that, 50% of our grade 7 students are fully vaccinated, and 70% of our grade 8 students are fully vaccinated, with another 1+ % of students having received one dose of a 2-dose series. These percentages are changing based upon the information that you as parents are providing to us on your child's vaccination status. So thank you very much for doing that. Our nurses are working hard at trying to gather that information and track it. So any questions you have, if you're unable to reach the nurses, please let me know. But this is where we currently stand. Will COVID testing be available for students and staff? So a screening program to test asymptomatic individuals who are unvaccinated or who are not fully vaccinated will be established according to the COVID mitigation plan that Jody had mentioned earlier on. For students, parental consent is required. As of now, there is no plan to test students or staff who present with COVID symptoms during the school day. Those individuals will be sent home, and the families will be encouraged to contact their healthcare provider for evaluation and possible testing. It is important to note, per CDC, and you'll see, and you could see in the Albany County Department of Health flow charts, the term fully vaccinated. So in order for someone to be fully vaccinated with a COVID-19 vaccine, it has to be 2 weeks out after their second dose in a 2-dose series, such as the Pfizer or Moderna vaccines, or 2 weeks out after a single dose vaccine, such as Johnson & Johnson's Janssen vaccine. And if you do not meet those requirements, then you are not fully vaccinated, and you could, you could have to quarantine. So just please note that it does take a period of time. So for Pfizer, which again is for students, individuals 12 and older, it takes 5 weeks to be fully vaccinated for that vaccine. And Moderna is a week longer because there's a 4-week interval between the first and second dose. Why are you only testing and screening unvaccinated individuals? So the CDC guidance states that people who are fully vaccinated do not need to participate in screening testing. However, in our district, we'll look to offer that screening as we are able to do so to vaccinated individuals who are interested in being tested and who provided us with consent. But the goal of COVID-19 testing is to really promptly identify and isolate those cases who have been exposed to COVID-19 who are not fully vaccinated, and to identify any clusters where the virus exists. The CDC recommends the screening testing in areas with moderate to high community transmission, and we are currently in a high transmission level, as Jody mentioned. They're also recommending it in areas with low vaccination coverage and for certain high-risk activities. So it is why we'll begin by focusing our screening efforts on individuals who are not fully vaccinated, as well as on those students who are participating in sports and other activities which present an elevated risk due to increased exhalation. What is accepted as ineligible for the vaccine for football players? What process is required to deem someone as ineligible? So again, the COVID vaccines are available to all individuals 12 and older, and they may be administered to most people with underlying medical conditions. If you have any questions about your child getting a COVID-19 vaccine, you should talk to your child's healthcare provider. If there is a medical reason preventing your child from getting the COVID-19 vaccine, you would need to provide documentation from your child's healthcare provider indicating that information. It will then be reviewed by our medical director, and he will make a determination on whether your child would be able to participate in a high-risk sport, such as football, without the COVID-19 vaccine. How will the district be handling contact tracing this year, particularly among students who are vaccinated? So CDC indicates that it is our local public health authorities that determine and establish the quarantine options. We will work with Albany County Department of Health as we did last year on all contact tracing efforts involving confirmed cases of COVID-19. The guidance regarding quarantine decisions and contact tracing, it was provided to us late Monday afternoon, as Jody mentioned, and we learned today that it is a draft document as they await further guidance from New York State Department of Health. But what's really important to note is that draft document, demonstrates the importance of that layered mitigation strategy, which includes that consistent and correct use of wearing masks, the physical distancing, whether there was physical contact between individuals, the length of exposure, and again, vaccination status is emphasized, and also whether the student individual is symptomatic or not. I understand the change in terms of vaccinated persons not needing to quarantine. Will vaccinated students and staff still be notified of exposure? Yes, although CDC guidance states that people who are fully vaccinated and do not have COVID-19 symptoms do not need to quarantine, they should be made aware of their potential exposure to a confirmed case. It was in early August when the CDC added a recommendation that fully vaccinated people who have a known exposure with suspected or confirmed COVID be tested 3 to 5 days after that exposure, regardless of whether they have symptoms, and that they wear a mask indoors for 14 days in public or until their test result is negative. Albany County appears to be following that CDC recommendation involving contact tracing and quarantine protocols. But again, we'll wait and see what comes out further from the State Department of Health. If a vaccinated high school student tests positive but is asymptomatic or has mild symptoms, how long will they need to stay out of school? Currently, the Albany County guidance states that anyone who tests positive would isolate for at least 10 full days and until each of the following conditions are met. At least 10 days have passed since the onset of symptoms, or if they never had symptoms, at least 10 days have passed since their COVID-19 test, and that they must be fever-free for 72 hours. It should be noted that the updated CDC guidance indicates 24 hours. So again, we'll be looking at some clarification regarding that. And lastly, the symptoms have to be generally improving before they're able to return to school. Will an elementary student or any unvaccinated student be required to stay home if a member of their household tests positive? Most likely, yes. I'm pretty sure yes, because current CDC guidance states that individuals not fully vaccinated who have had close contact, which is defined as being within 6 feet of someone for a cumulative total of 15 minutes or more over a 24-hour period, they should quarantine at home and be referred for COVID-19 testing. And regardless of that test result, they would need to quarantine for at least 14 days after exposure. So that unvaccinated child would be quarantined because it is very difficult to maintain maintain physical distancing in the home and not have that cumulative time of exposure. So yes, they would be quarantined. Will a negative COVID test or quarantine be required for a student's return after being kept home sick? So anyone with symptoms of illness compatible with COVID-19, and they are still the same symptoms that have been listed before, should follow up with their healthcare provider for evaluation and possible testing, regardless of their vaccination status. If testing is recommended and the test result is negative, the student will be able to return to school per our current illness management policies, meaning that they have to be fever-free for 24 hours without fever-reducing medications. They have to have improvement of symptoms. If they were diagnosed with something such as strep throat and they were prescribed an antibiotic, they need to be on the antibiotic for 24 hours before returning to school. If the student's COVID-19 test result is positive, then Albany County will provide the family guidance on isolation protocols. If the healthcare provider determines that testing is not recommended due to there being an alternative diagnosis, a known diagnosis, and the student presents in the same manner, then we would request that documentation from the healthcare provider, very much like we did last year. So we will take those documents that we provided to you as parents last school year about absence from school and dismissal from school, and the communication with your healthcare providers will be outlined in that document.
Thanks, Joanne. I think the next group are mine. There be school musicals this year? We do expect to have musicals. However, students participating in any extracurricular activity that is considered high risk, such as singing or wind instruments, as well as sports, will be required to be vaccinated. Is the district going to consider allowing students to take off masks when sitting in classrooms like we all can while seated in restaurants? So not at the beginning of the school year, we're not. Students will be required to be masked at their desk. Obviously, they can remove their mask to eat and for mask breaks, but they will need to put their mask on when they're not eating. Would we consider allowing recess for elementary students without masks? Again, I think I spoke to this earlier. The guidance does indicate, and the quarantine protocols indicate 3 feet distancing or greater outdoors. And when you were having recess, the last year we had very structured recess activities. We didn't allow cohorting generally, and we felt this year we wanted to allow kids the opportunity to play at recess, to use all the playground equipment, less structured. And in order to do that, we can't guarantee that those students will maintain 3 feet distancing. So as we begin the year for recess, they will be required to wear masks outdoors. And hopefully as things improve, we'll be able to make some changes with that. The district is encouraging parents to drive students to reduce bus occupancy because we're in the red zone. Will we lose our spot on the bus and already filled out if we've already filled out the bus commitment form? So the goal of asking parents to indicate if they wanted to use our transportation was, I think everyone's aware, we do have a shortage of drivers, and we wanted to make sure that we were routing as efficiently as possible. If you indicated you wanted to take the bus, but now you are planning something differently to transport your child, please do contact transportation and let them know so they can plan accordingly. If you opt to not have your child take the bus at the beginning of the year, and at some point during the year you want to take advantage of that, you simply need to contact transportation at that time. It generally might take a day or two notice for them to make sure they get your child on the transportation routing system. But really having accurate information is very helpful for us this year. So if people can do that, we greatly appreciate it. And will students have assigned seats on the bus, and spacing will be observed? We will continue with assigned seating, both in our schools and on the buses for contact tracing purposes. Students, if they're with family members, they will be seated together like they were last year. Because the bus, we can't really guarantee distancing requirements. There are no, obviously, to the greatest extent possible, we will, but that's why masks are required for everyone on the bus. Are there any special protocols we have to follow if we travel? There are no restrictions on travel at this time. If there are any changes to that, we'll be certain to convey that information to families. If you're requiring football players to be vaccinated in order to play, will they only be playing schools who have that same requirement? I think I spoke about this earlier. Some other districts are requiring vaccinations for those high-risk activities. We are not planning to alter the schedule at this time. Would we consider allowing vaccinated students and staff increased freedom such as not wearing masks inside, being allowed to sit at cafeterias, tables? So currently, when transmission rates are in the higher, the orange and the red, especially while half of our student population is still not eligible for a vaccine, we will continue to keep our plans as they are. So as things hopefully improve, we will be able to make some changes. But right now, as we begin the year, we do have restrictions in these areas. high risk sport. Oh, there's no knowledge about whether coaches are vaccinated. So I think I addressed this earlier. We have asked our staff, including all of our coaches, to provide the district with vaccination status. I do think it's important to note that student athletes who are competing are face-to-face on the playing field with sustained interactions with coaches is not really a factor, but I want to reassure people we are collecting all of that information on our staff. Last year, there was a state, Governor Cuomo did mandate if there were positive cases in the region were above 5%, we would be required to close. And is there a threshold this year? So there is no threshold. This was done by the governor in an executive order. However, if we are directed to close at any point, we would need to do so. I think more importantly, we are closely monitoring our transmission rates. And we'll do so within our school community. Last year, we did not have any evidence that there was school-based transmission. However, we did have, I think people who were in the district knew, we did have widespread quarantine. And really, many of the reasons we had to go to a remote model was because of staff shortages and large numbers of students who were quarantined. So we are hopeful that that will not happen this year. We also, I want to just say, we do work, as Joanne mentioned several times, closely with the Albany County Department of Health to monitor any transmissions in the community as well as our school. Air quality and filtration, we actually made changes to this last year and we'll continue to do the same. We are using the MERV 13 air filters, which were recommended. They have been installed in August to be in place again for the start of the school year. We also have fresh air dampers, and once classes begin, they will be running at 100%. So this means spaces are receiving fresh air from the outside rather than recirculating air within the building. And as we've mentioned several times, when weather permits, we are encouraging open windows and taking kids outside whenever possible. How quickly can we respond to changes in community transmission, and how frequently will it review certain restrictions? So, I don't think with the community transmission, the CDC guidance, we're going to go from red to yellow overnight. We will be tracking this regularly. We work closely with all of our local school districts, with the departments of health. So we will keep an eye on where the rates are, and hopefully if we see trends downward and need to make some changes to our plans, we'll do so, and we'll be communicating with our staff and families this information as that happens. But I wouldn't expect large changes overnight, just by the way the CDC community transmission guidelines are set up. Why is the district being so stringent when it comes to community use of school facilities? Locally, I know we have calls, we have meetings with Capital Region BOCES, which is 24 school districts in the Suburban Council. To my knowledge, every school district who's in the red zone, which is where Albany County is currently, based on the recommendations of CDC, is to restrict outside groups using facilities. If we in fact move to different levels, obviously that becomes less restrictive. For example, we will allow in the lower zone to consider allowing outside groups that have Bethlehem students only. So we did make a change to that plan since we've released it. And that is all the questions that were submitted in advance. I'm sure there's probably some questions that have been submitted during the course of this presentation. And if you have questions, if you could put those in the Q&A, we'll respond to as many as we can. And I'm going to stop sharing my screen. Joellen, do we have some questions to respond to?
I do have a few. Now, I did have a couple from that were submitted that that didn't make it to the presentation. So let me see if I can get to a couple of those as well. Do you know, will the school be partnering with any other local health agencies to allow for quick access to testing?
I'm not sure what's meant by health agencies. I don't know, Joanne, do you know? I mean, I think most people are contacting their physician. I know some people have gone to some of the urgent care facilities, I think generally have testing availability as well, but I guess I'm not sure what they mean by other health agencies.
Okay,
I'm not sure either, but I do know that they should begin with their healthcare provider. But also we have provided links to parents before through the Albany County Department of Health where they have testing sites available as well. So we can make sure that that information gets shared again.
Just to add to that, I guess, I know all the local departments of health did receive federal funding to assist schools with testing. And I know that some schools or some local departments of health are arranging pool testing with districts. We've not heard anything about testing from Albany County, but we're hopeful that we will hear something soon about what the plans are for offering and providing support to schools in this area.
thank you. And I don't know, without Mr. Klugman being here, there is a question in the queue. Will middle school stagger when students can visit their lockers? Do we know this? Is that?
I don't know. I would say probably best to email Mr. Klugman directly about that. I'm not sure of that answer.
Okay. Are there any clubs that will require vaccination in order to participate?
So any club that's considered high risk, which someone asked about the musical, those students who are singing would be considered a high risk activity. Some of our ensemble groups that are an after school club as well, if there is singing or wind instruments, would also be deemed high risk. So those would require vaccines as well.
Okay. And I see someone is typing this answer, but I think it's worth just mentioning. Will visitors and parents be allowed in the schools?
So on our plan, in the high transmission zones, which we are currently in, those are pretty restricted, similar to last year. And as we move forward, obviously you can see on our plans that that would be loosened up. But in the high transmission area, which we're currently in, that access will be very limited.
Okay. And our panelists have done an amazing job of answering questions that came in. Oh, here's one. Will parents need to do the daily screening this year?
No, I think they'll be very happy not to have to do that. It's not required this year.
Okay. And you got a yay out of that. Okay. So let's see. Oh, will high school students be able to go to other schools? So, I mean, sometimes like members of the green team would go to elementary schools. What would the protocols be on something like that?
When we are in the high transmission zones, we're going to limit that. We did have last year, I know some high school students did some virtual meets with kids in other schools. And so that's certainly an option. We are hoping that, as transmission rates drop, that we would be able to allow some of those things to happen, because I know that especially, the younger kids, elementary, middle school, do enjoy having high school students come and visit and share information. So hopefully we'll be able to do that sooner rather than later.
Okay. And I just want to check. It looks like Maybe, here's a question. I think for Dr. Gafuri or perhaps Joanne, will a negative at-home COVID test be accepted? Will a positive at-home COVID test require a PCR test to confirm?
Sure, I can answer that. The at-home test, a rapid test, will not be accepted, and you will need to do a molecular test to confirm that.
Okay,
And
thank
can
you.
I also add one other thing? I know the daily screening is not required this year, but I think parents do need to pay careful attention to their kids when they get up in the morning. And if they have a symptom, even one symptom, that could be COVID or any respiratory symptom, they wake up with a runny nose and some cough, they really should stay home this year. So a single symptom can be enough. And they should stay home. They should be in contact with their physicians and, clarify with their doctors what's going on.
During a workshop this morning with Dr. Whaling at Albany County Department of Health, she had mentioned what one of the most common symptoms that they're seeing in the pediatric population of students who tested positive was just a headache. So just be, I guess, aware of those symptoms, and again, to follow up with your child's provider on any symptoms at this point. Dr. Gafuri, could you speak to the one thing, there's been a few questions that have come to nurses. When an individual is diagnosed with COVID-19, the clearance process that should occur after their illness with their pediatrician, if they're an athlete, as well as if they're a non-athlete, and why that needs to happen.
Yeah, first of all kids that are diagnosed with COVID should be in contact with their physicians, even if they're mild, even if they're asymptomatic. They should have a clearance prior to resuming any physical activity, and including club sports, at-home activities, things like that. There have been some cases of serious myocarditis, heart inflammation associated with very mildly symptomatic COVID or even asymptomatic COVID. The numbers probably, I know initially a few months back, I think the numbers that were being thrown around were quite high, even up to about 20 to 25%. Lately, it looks like we're more, the cases are really more in the realm of 0.5% up to about 3%, but a real number. So these kids should be cleared by their physician if they have COVID. If they have a positive COVID test, they should be cleared. If they have symptomatic cases, there are varying levels of severity, then these kids, some of them will need further clearance if they have symptoms that are lasting more than a week, if they have more than 4 days of fever. They have certainly any child that needs to go to the hospital with COVID is going to need further evaluation prior to returning. In many cases, they'll need an EKG done. In many cases, they may even need to be seen by a cardiologist in those settings. So, I think the mild cases, these kids don't even necessarily have to go see their pediatrician or primary care doctor. In many cases, they can be cleared even with a telephone or telehealth visit. But it is important that it be done.
Thank you. And we have a district form that we would provide to you as parents to have your physician complete. So just reach out to your school nurse and get that, or they will provide it to you. Thank you.
Do we have any other questions that haven't been answered, Joellen?
Hang on, let's see. how will attendance policies be adapted for students who need to be out of school several times, several days at a time to comply with the steps just described?
So I think that, since we started dealing with all of this, obviously we have an attendance policy that's approved by the board. But we also recognize that we need flexibility. And really the biggest way to prevent any issues with the attendance policy is simply by families communicating with us as to why their child needs to be out, or if they have quarantine orders from the Department of Health, why they're out, or they're awaiting test results, whether it be, rapid tests or PCR tests. So that's one thing that I think families can do to make sure that we don't just think kids are being out and the teachers don't know why a student is out for several days at a time. So that communication is really important. Contacting the school nurse, obviously, because we do want to track absenteeism and why students are out. If there's real concerns about a child falling behind in academics, obviously reaching out to the school counselor. So I would just encourage parents to stay in touch with us. If your child is out, we know we are going to need to be flexible. We know it's not traditional times. So we'll absolutely work with you on absences that need to take place because of health and safety concerns.
And that looks like our last question.
Okay. I want to thank our panelists for joining us, Dave, Laura, Joanne, Dr. Gafuri, and of course, Joe Ellen for putting this together, and Navarre, who's been in the background with all of our tech support. I'd like to thank all of our families for joining us. I know that, it seems like every day there is definitely some changes and we're learning more. I know it's, a little discouraging last year at the end of the year. I think we were all hopeful that things would be a little more improved than they are right now. But we really are looking forward to having all of our students back. We are looking forward to having some more typical things than we've had in the past, and are hopeful that things will be more flexible, hopefully, as we move forward. I am going to present our reopening plans with any changes that we have between now and next Wednesday, next week at the board meeting. So if families are interested, please feel to tune in via YouTube to watch, and I'll hopefully provide any updates. And again, thank you so much for all of your support and flexibility. I know it's challenging times for you, just as it is for all of our students and staff. So we really appreciate everything that you're doing to support our schools. And I hope everyone has a great afternoon. The sun is out. It's not raining, so I hope you enjoy the evening. Thanks so much.